thank you for the opportunity to address you all today. This is obviously a very complicated topic, and I think there was a quote I read with Dr. Apley, as soon as you think you understand it, you probably haven't looked at it enough. And the discussion of One Health, I think, is really important as we look at antibiotics because it is so complicated. I think all of us are here because we know that we play a role to try to make sure that we're utilizing antibiotics very judiciously. But it's complicated. And I think the area that I play in as our chief veterinarian with Elanco is ensuring that as we have these conversations, that we ensure that we keep the animal in the center of the conversation. So we all want to do what's right. And as Dr. Apley shared, it's not always easy to figure out what to do and how to do it the right way. You've got competing interests. You've got the patient in front of you, and you have the larger discussion that we have to do. And so as I have conversations with stakeholders, this is really kind of where I ground myself at, is in that space between sustainable animal production and responsible animal production, there's lots of pillars. And there's lots of things that need to go into our discussion as we're making scientific and public policy. And antibiotic stewardship is one of those things. But there's also a lot of other discussions that we need to have in there. And as a veterinarian, these are some of the other things that I think about when I start making my decisions on prevention, treatment, and control programs for animals. So it's the vaccination program. So what are we going to do to try to prevent disease? It's the biosecurity also playing in the role on preventing disease, much to Dr. Apley's point. It's making sure that we have the right plane of nutrition for those animals. It's ensuring proper animal welfare. It's ensuring that we have a safe food supply by having the right programs in there for mitigation. And then obviously the environmental management is critically important with those things. And all of these play into this concept around One Health. And so I think it's really important as we're having these conversations to keep the animal in the center of these conversations and making sure that we don't put our public policy in front of the science. Dr. Apley set this discussion up beautifully because he talked about the difficulty in finding those antibiotic alternatives. And so it's really important that we ensure that we have all these things working together before we decide to take the toolbox or the tools out of the toolbox for that veterinarian and the producer. Dr. Singer and his colleagues put together a great survey of veterinarians, producers, others that are involved in animal production. And I think this is really the first of its kind to kind of look at attitudes and perceptions as well as realities of those that are involved in production. And the other thing that I think was really great is that they looked across all the different commodity groups. And so many times we tend to only talk to our own individual commodity group, which is the nice thing about this meeting is we get that opportunity to look across all the different groups. So he had over 550 different producers, veterinarians, and stakeholders that were surveyed in this. About half of them were veterinarians, about half were producers, and we had about equal representation that were directly involved in Raised Without Antibiotic programs or No Antibiotics Ever programs, and about half that were involved in conventional. So those that were involved in the Raised Without Antibiotic programs obviously have firsthand knowledge of those production systems, and those that are involved in conventional, it's more their perception of those production practices. But one thing you'll notice is that all of them felt that we had a slightly worsening impact on animal health and welfare. But we compare and contrast that to the perception of the consumer's viewpoint on Raised Without Antibiotic programs and conventional programs. And I think that's where those of us as veterinarians, those of us that are producers, those of us involved in animal agriculture, we have a great opportunity to share the story of what we do in animal agriculture, to talk about what we do and to talk about it not only to ourselves, but those that are out in the consumer base. So having that conversation with the random person sitting on the airplane next to you, having the conversation at dinner as folks come to your home for Thanksgiving that aren't directly involved in animal agriculture and sharing what we do in animal agriculture. we do have data that supports that there are some worsening effects with kind of swinging the pendulum from maybe conventional agriculture and swinging it the other way to no antibiotics ever. I work as a poultry veterinarian, is where I've spent my career at Elanco. And what we've seen over the last few years is a dramatic increase in raised without antibiotic production schemes. So about half of our chicken produced now is under the raised without antibiotics or NIAA label. And what we've seen over the last few years is that we have seen an increase in mortality. The good thing to me is that we are seeing that difference between conventional and raised without antibiotics. That difference, that delta, is decreasing, which tells me that we're getting smarter about our production practices. So that is a really good thing. We are taking better care of our animals. We're improving the environment that they're in, improving those vaccination and those health programs, all of those pillars that we talked about. But I think as we look at policies that we're making around antibiotics, we have to make sure that we're looking for those intended consequences of improving outcomes, of impacting antimicrobial resistance, but we don't need to make sure that we don't lose sight of some unintended outcomes that may happen. When we looked at our data in our database, we have a health tracking system that we utilize at Elanco. We look at thousands and thousands of birds across the U.S., and we've done this for a number of years. We compare those programs of those birds that are raised without antibiotics versus those that are conventionally raised, and we have seen some negative health outputs related to ammonia burns, foot pad lesions, and airseculitis in those birds. And when we look at the data that comes from Agra Stats, it also supports this, that we've seen an increase in mortality. It takes us a little bit longer to grow those birds. We may have to change the density, and then we increase the downtime between flocks so that we can decrease the amount of pathogens that may be in that house that the birds would potentially be exposed to. Some of those things are great. Increasing the downtime is a very positive thing to try to prevent disease in that next flock. The one thing that we have to consider, and it's really part of that One Health approach, is that we still have to meet the demand of feeding the world and feeding people around us and our neighbors. And so in order to meet that demand, we have to add more birds to the population. And when we add more birds to the population, we also have to feed those birds. Those birds also produce manure, they consume water, and so we have to create that balance of ensuring animal health and welfare and making sure that we're taking care of the environment as well as protecting public health. And I think that's always the dilemma as we're trying to look at these things, that they're not cut and dry, that they are very complicated issues, as Dr. Apley spoke to. And then the last thing I'll share with you again from Dr. Singer's study is making sure, again, as I've said, is keeping the animal at the center of these discussions on public policy and our scientific efforts, and ensuring that we don't have label or marketing outcomes that become more important than what we're doing to protect the animal welfare and protect AMR. And so I think we have an opportunity, those of us that are stakeholders in animal agriculture, to ensure that we're doing everything we can to utilize antibiotics very judiciously and improve all those other inputs that come into raising animals. But we also have an obligation to ensure that we're taking care of the health and welfare of our animals that are within our care.